Do all parotid tumors need to be removed, even all benign ones? I'm Dr. Babak Larian from Center for Advanced Parotid and Facial Nerve Surgery. That's the most important question. Parotid tumors are uncommon. They can be of varying sizes, and they can grow to be massive. Fortunately, most parotid tumors are benign. So 80% are benign and only 20% are cancerous. The tumors can, again, be of varying sizes. You can see the cross-section of there. You can see the tumor, and as it grows, it can get larger, and if it gets larger than that, it can entangle the nerve, right, which is seen in white here. There are many different types of parotid tumors, right, because there's so many stem cells and progenitor cells in the parotid gland that they can turn into all sorts of different types of tumors. So there's 15 benign tumors. The most common one at 72% is pleomorphic adenoma, and then there's 14 other ones. Pleomorphic adenoma, it's odd because it has a genetic makeup that's precancerous of sorts, meaning that it has the potential of transforming into a cancer, whereas the other 14 don't have that potential. So if you do a needle biopsy and you find that your tumor is, let's say, a basal cell adenoma, and it's tiny, tiny, right? And it's not growing, it's not pushing on anything, I don't think there's any reason to remove it. Now, your needle biopsy sample needs to be adequate. You need to be fairly certain that the pathologist has got the right answer, right? And it's not growing. It can be easily monitored by feeling it or by doing an ultrasound. Then yeah, there is no reason to remove that because that mass is not going to harm you. If it's growing and it's going over the time or fast, yes, you should remove it. If it's a pleomorphic adenoma, definitely you should remove it. If you get your needle biopsy and it's any of these 21 types of cancers or a lymphoma, then you have to address it. You can't leave that alone. But if you have one of the 14 benign tumors that is never going to turn into a cancer, the question of removing it has to do with symptoms and growth. If it's not giving you any pain or discomfort, and if it's not growing and pooching out of the face or pushing inwards towards the facial nerve, then there is very little reason to remove that, okay? And sometimes people have benign cysts in the parotid that are not growing and that are not getting infected. Those don't need to be removed either because they're not bothering you or causing any harm, right? You have to be in a position where the treatment is not worse than the disease, right? That's really, really crucial and important. Okay, if you have a benign tumor that's never going to turn into a cancer and it's small and it's not growing, the potential risk of a surgery can be more than what this mass can offer you. Okay, so we have to be very smart. Painting everything with one brush that any mass in the parotid gland needs to be removed is just unwise because you may cause complications for something that was never going to harm you. And that's why you need to see someone who has expertise in treating with parotid tissue and a very, very healthy respect for the facial nerve, right? And so be deliberate, be smart, get information, make sure you have the right doctor that you can communicate effectively with and is eager to help you out in the right way and is just not going to do surgery without clear intention. If you're interested in clear parotid information and safe, minimally invasive approaches, visit us at parotidmd.com.